She was losing herself, strand by strand. Thelma Robinson, daughter of one of America's most decorated admirals, watched her hair fall away each morning, and no one could tell her why. Over 300 surgeons examined her. The best medical minds in the country ran every test imaginable. Nothing. Her father, a man who'd commanded fleets through war, stood powerless in a hospital room, watching his daughter fade. Then one night, Nurse did something different. She didn't just check vitals. She looked where no one else had looked. And what she found hidden beneath those falling strands would expose a failure that shook an entire hospital to its core. Before we continue, please subscribe to the channel and let us know where you are watching from in the comments. Enjoy the story. Thelma Robinson counted them every morning. Not out of vanity, out of fear. 23 strands on her pillow when she woke. 41 circling the shower drain after she washed what remained. 67 tangled in her brush as she tried, desperately, to make herself look normal. At 24 years old, she was disappearing, piece by piece, and no one could tell her why. The sunlight streamed through the tall hospital windows that Tuesday morning, filling her room with a warm, golden glow that seemed almost cruel in its beauty. Because while the world outside continued in its ordinary rhythm, people rushing to work, children laughing on their way to school, life moving forward. Thelma sat on the edge of her bed, slowly brushing loose strands of hair from her trembling palm, watching herself vanish in slow motion. She'd developed a ritual, though she hated admitting it. Each morning, she'd gather every fallen strand she could find, count them, record the number in a small notebook she kept hidden in her nightstand drawer, as if somehow, by tracking the loss, she could make sense of it, as if numbers could explain what all the tests and scans and specialists could not. This wasn't normal hair loss. This wasn't the kind of thing that happens when you're stressed about exams, or going through a breakup, or dealing with the everyday pressures of being a young woman trying to find her place in the world. This wasn't genetics. Her mother had thick, beautiful hair well into her 60s. This wasn't anything the textbooks prepared doctors for, anything that fit into neat diagnostic categories, anything that made sense. This was something else, something invisible, something that moved through her body like a silent thief, stealing pieces of her identity while everyone watched, helpless and confused. And the truly terrifying part? It had already stumped over 300 of the country's best medical minds. 300 highly trained specialists who'd examined her, tested her, scanned her, analyzed her blood and her hormones and her genetic markers. 300 experts who'd asked every question, run every protocol, consulted every database and textbook and colleague they could think of. 300 brilliant doctors who all came to the same devastating conclusion. They had absolutely no idea what was wrong with Thelma Robinson. Her reflection in the mirror had become a stranger. Where thick, dark waves once framed her face, now thin, fragile strands clung desperately to her scalp. She'd tried everything to hide it. Scarves, hats, careful styling that took hours each morning. But you can't hide from yourself. You can't pretend away the handfuls of hair that come away when you run your fingers through what's left. You can't ignore the way people's eyes flicker with shock, then quickly look away, pretending they didn't notice. The worst part wasn't the physical loss. It was the uncertainty, the not knowing. The creeping terror that maybe this would never stop, that she'd wake up one morning completely bald, still with no answers, still with no hope. That maybe, somehow, impossibly, this was all in her head, even though the evidence lay scattered across her pillow every single morning. But before we understand what Nurse Leora Vance discovered that night, before we get to the moment that changed everything, you need to know just how impossible this case had become. You need to understand the depth of the mystery, the frustration of the search, the desperation of a young woman and her father as they navigated a medical system that had all the tools, all the knowledge, all the resources in the world, and yet still couldn't save her. Because the answer wasn't hiding in some rare disease database, buried in obscure medical journals that only specialists read. It wasn't lurking in genetic abnormalities or exotic autoimmune conditions or strange hormonal imbalances that required cutting-edge research to identify. It was hiding in plain sight, under everyone's noses, for over a year. If you've ever felt invisible in a room full of experts, or watched someone you love suffer while everyone else just shrugged and moved on to the next theory, the next test, the next dead end, hit that subscribe button right now. Because this story proves that sometimes the truth isn't found in credentials or years of medical school or prestigious hospital appointments. Sometimes it's found in careful attention, in someone willing to actually look, in someone who refuses to stop seeing the person buried beneath all those charts and test results. And if you can't stand medical arrogance, if you're tired of watching people suffer because the so-called experts are too proud to admit they might be missing something simple, comment, listen to nurses right now. Admiral Albert Robinson wasn't used to feeling powerless. For 32 years, he'd commanded respect without demanding it, made impossible decisions in moments when hesitation could cost lives, led thousands of men and women through dangerous waters, both literal and metaphorical. He'd received commendations from superior officers who rarely gave praise, medals pinned to his chest by generals who'd seen everything war could throw at them, honors from 3 different presidents who understood what it meant to serve your country with unwavering dedication. His office at the naval base told the story of a life lived in service. Polished medals lined one wall, each one representing a moment of courage, a crisis averted, a mission accomplished against impossible odds. Photographs captured handshakes with world leaders, ceremonies on aircraft carrier decks, moments of triumph that had defined his career. In the center of it all hung a family portrait. Admiral Robinson in his dress uniform, his late wife beside him, and Thelma, maybe 8 years old, grinning at the camera with that smile that could melt the sternest military discipline. But none of that mattered now. None of those medals could help him. None of those connections to powerful people could change what was happening. None of those resources accumulated over 3 decades of distinguished service could do a damn thing to save the one person who mattered most. Because his daughter Thelma was suffering, and all his authority, all his carefully cultivated relationships, all his ability to make things happen with a single phone call, it was all worthless in the face of a mystery that even the best doctors in America couldn't solve. Thelma had always been his pride. Not in the way some military fathers pushed their children into uniforms and expected them to follow rigid paths. No, his pride came from watching her become exactly who she wanted to be. She graduated top of her class at Georgetown, not because he demanded it, but because she had this fierce intelligence that couldn't be contained. She volunteered at veterans' hospitals every weekend, sitting with wounded soldiers, listening to their stories, bringing light into rooms that had seen too much darkness. She wanted to go into medicine herself, to help people the way her father had served his country, to make a difference that wasn't about rank or authority, but about genuine human connection. She had this infectious laugh, this way of lighting up every room she entered. People gravitated toward her without understanding why. She'd walk into a formal military reception, events that were usually stiff and uncomfortable, and within minutes, she'd have stern-faced generals chuckling at some story, younger officers relaxed and genuine in her presence. She had her mother's warmth, that rare gift of making everyone feel seen, valued, important. He remembered her as a child, running across the naval base lawn, pigtails flying, shouting "Daddy's home," every time he returned from deployment. He remembered her teenage years, the long conversations about philosophy and ethics and what it meant to live a meaningful life. He remembered her college graduation, the way she'd found him in the crowd and mouthed, "Thank you," before accepting her diploma, and how his chest had swelled with a pride so fierce it nearly knocked him over. And then, 13 months ago, everything changed. It started so small. A few extra strands in the shower. Nothing alarming. Thelma mentioned it casually over dinner one night. "I think I'm shedding more than usual," and they'd laughed it off. Stress from her new research position, changes in her diet, the normal fluctuations that bodies go through. But it didn't stop. It got worse and worse. And what started as a few extra strands in the shower became a medical mystery that would expose just how broken our healthcare system really is, how even the most qualified experts can miss what's right in front of them, how a father's love and a lifetime of influence mean nothing when the system fails. But we're getting ahead of ourselves. Let me tell you who looked at Thelma Robinson's case. First, her primary care physician, Dr. Mitchell, who'd known her since she was 16. He ran the standard blood panels, checked her thyroid, her iron levels, her vitamin D. Everything came back normal, so he referred her to a dermatologist. Then came Dr. Sarah Patel, a dermatologist with 20 years of experience in hair and scalp disorders. She examined Thelma's scalp under magnification, took samples, tested for fungal infections, bacterial issues, inflammatory conditions. Nothing. So she sent Thelma to endocrinology. Then 3 different endocrinologists entered the picture because Thelma's thyroid numbers seemed slightly off, not abnormal enough to explain the hair loss, but off enough to warrant investigation. They adjusted medications, monitored hormone levels, ran tests for Hashimoto's disease, Graves' disease, adrenal insufficiency. The numbers normalized. The hair kept falling. Then 2 rheumatologists, suspecting autoimmune disease. They tested for lupus, for alopecia areata, for scleroderma, for every condition where the body attacks itself. They put her on immunosuppressants as a trial. No change. Then 4 neurologists when someone finally noticed that the hair loss seemed to concentrate near her neck, near the base of her skull. They tested for multiple sclerosis, for muscular dystrophy, for nerve damage, for brain lesions. They did nerve conduction studies that made Thelma wince with every electrical pulse. Nothing conclusive. Then an oncologist, just to rule out the unthinkable. Because sometimes hair loss is the first sign of something darker, something that hides in bone marrow and lymph nodes. The scans were clear. No cancer, which should have been relief, but somehow felt like just another dead end. Then specialists in nutritional deficiencies. Maybe she wasn't absorbing nutrients properly. Maybe some obscure vitamin deficiency was causing this. Then genetic counselors and specialists in genetic disorders. Maybe there was some rare mutation, some inherited condition that only expressed itself in adulthood. Then psychiatrists specializing in stress-related conditions, because the mind-body connection is real, and sometimes trauma manifests physically. Then immunologists focused on rare autoimmune diseases that don't show up on standard panels. Then more endocrinologists examining hormonal imbalances beyond just thyroid. Cortisol, estrogen, progesterone, testosterone, growth hormone. Then environmental medicine specialists testing for toxin exposure, heavy metals, industrial chemicals, mold, things most people never even consider. Over the course of 1 year, Thelma saw 87 different doctors. She underwent 143 separate tests, blood work that left her arms bruised and tender, biopsies that took pieces of her scalp for examination under microscopes, MRIs where she lay perfectly still in claustrophobic tubes while machines hammered and whirred around her, CT scans that flooded her body with radiation in search of answers, genetic sequencing that mapped her entire DNA looking for mutations, panels for diseases so rare they didn't even have pronounceable names, conditions that affected maybe 12 people worldwide. And through it all, Admiral Robinson sat in waiting room after waiting room, a man who'd once commanded aircraft carriers, who'd made split-second decisions that affected thousands of lives, who'd stared down international crises without blinking, now helpless as a child, watching his daughter's hair fall in quiet clumps onto sterile floors, unable to do anything but hold her hand and promise that the next doctor would have answers. But here's what made this case so terrifying, what kept both of them awake at night, what made even the most confident specialists eventually fall silent. Every test came back normal. Not inconclusive, not borderline, not, we need more data. Normal. Completely, definitively, inexplicably normal. As if Thelma's body was perfectly healthy, functioning exactly as it should, following all the biological rules. Even as she visibly deteriorated before everyone's eyes, even as her reflection became less and less recognizable, even as she lost not just hair, but hope. The specialists started whispering, first in medical conferences behind closed doors, then more openly. Maybe it's psychological. Maybe it's stress manifesting physically. Maybe, somehow, she's doing this to herself without realizing it. Maybe the problem isn't in her body at all. And that's when Admiral Robinson made a decision that would change everything. St. Catherine's Medical Center, ranked in the top 10 hospitals in America, home to some of the most brilliant medical minds in the world, cutting-edge technology that most facilities could only dream of, research programs that pushed the boundaries of what medicine could accomplish. If anyone could solve this impossible mystery, it would be them. The Admiral pulled strings. He called in decades of favors from colleagues, from politicians he'd worked with during his naval career, from anyone who owed him anything. He leveraged every connection, every relationship, every ounce of influence he'd accumulated over 32 years of distinguished service. And finally, he got Thelma admitted to their diagnostic unit. a place where the impossible cases went to get solved, where teams of specialists collaborated across disciplines, shared insights, approached medical mysteries with fresh eyes and unlimited resources. For 6 weeks, Thelma became their project. Doctors rotated through her room in teams of 5, 6, sometimes 8 at a time. Senior physicians, junior residents, specialists from different departments all gathered around her bed, discussing theories, debating possibilities, examining her like she was a fascinating puzzle that just needed the right combination of brilliant minds to crack. They reviewed every previous test she'd undergone, looking for patterns the other doctors might have missed. They ordered new ones. More sophisticated imaging, more detailed genetic analysis, experimental blood panels that tested for markers most hospitals didn't even know existed. They consulted international databases of rare diseases. They reached out to colleagues at Johns Hopkins, Mayo Clinic, Cleveland Clinic, asking if anyone had ever seen anything remotely similar. They were thorough. You couldn't fault them for that. They were professional, systematic, genuinely invested in finding answers. Some of them spent their own time researching, reading obscure medical journals late into the night, determined to be the one who solved the mystery that had stumped everyone else. They approached Thelma's case with intellectual curiosity, with competence, with all the tools and knowledge that modern medicine could provide. And one by one, week after week, they came up empty. Thelma stopped asking questions after week 3. She'd learned to read the look in their eyes. That subtle shift from confidence to confusion to barely concealed frustration. It happened the same way every time. A new doctor would walk in, posture straight, voice assured, explaining their theory about what might be causing this. They'd examine her, order their tests, promise they were close to an answer. And then, a few days later, that same doctor would return, shoulders slightly slumped, avoiding direct eye contact, using phrases like unexpected results and we need to explore other avenues. She'd hear them in the hallway outside her room, voices low but words clear enough to make out. I've never seen anything like this. Nothing in the literature matches this presentation. We're running out of options here. At night, when the hospital quieted and the parade of specialists finally stopped, Thelma would lie in her bed staring at the ceiling, running her fingers through what remained of her hair. The strands felt thinner every day, more fragile, like they might disintegrate at her touch. And in those dark, silent hours, she'd wonder if she was going crazy. If somehow, impossibly, all those specialists were right, and this was all in her head. If she was manufacturing her own suffering through some psychological mechanism she couldn't control or understand. But remember what I told you at the beginning? The answer wasn't hiding in some rare disease database, wasn't buried in obscure medical literature that required international consultations to access. It wasn't in blood panels, or genetic markers, or autoimmune titers, or any of the sophisticated tests they kept running. It was somewhere much simpler. Somewhere that 300 experts had looked right past, too focused on finding complexity to see simplicity. If you've ever been dismissed by someone who was supposed to help you, if you've ever been made to feel like your suffering wasn't real because the tests couldn't explain it, if you've ever wondered whether you were imagining your own pain, comment, I believe you, Thelma, right now. Because what happens next proves that sometimes the most qualified people in the room, the ones with the most impressive credentials and the longest lists of publications, are the ones who miss the most obvious truths. It was week 7 at St. Catherine's when Admiral Robinson finally broke down. Not in public, not where any of the doctors or nurses or other patients could see, but late one evening, standing alone in the hospital chapel. A small, quiet space with wooden pews and stained glass windows that caught the fading sunlight. This decorated war hero, this man who'd stared down enemy combatants without flinching, wept. He'd run out of strings to pull, out of favors to call in, out of hope. And that's exactly when Nurse Leora Vance walked into Thelma's room. Leora Vance wasn't supposed to be anything special. At least, not according to the hospital hierarchy that governed St. Catherine's Medical Center like an invisible caste system. She was 29 years old, had been a nurse for 6 years, worked mostly night shifts in the diagnostic unit, the graveyard hours when the hospital settled into a different rhythm, quieter but somehow more intense. Competent, quiet, thorough, those were the words that appeared in her performance reviews. Good with patients, follows protocols, reliable, but just a nurse, not a doctor. not a specialist, not someone whose opinion carried weight in the conference rooms where Thelma's case was endlessly debated. Just a nurse who took vitals, administered medications, updated charts, and tried to make patients comfortable while the real medical minds did the important work of diagnosis and treatment. She'd heard about the Admiral's daughter, of course. Everyone had. The case had become something of a legend in the hallways, whispered about during shift changes, discussed in the break room over stale coffee and vending machine snacks. The mystery that stumped everyone. The girl who was losing her hair for no reason at all. The impossible case that had attracted specialists from across the country, all of them eager to be the one who finally cracked it. All of them eventually adding their names to the growing list of experts who'd failed. Some of the nurses felt sorry for Thelma. Others were frustrated by the constant parade of consulting physicians who disrupted normal ward routines, demanding special accommodations, treating the nursing staff like glorified assistants rather than healthcare professionals in their own right. But Leora just felt curious. Not in a morbid way, not in the way some people are drawn to tragedy. She was curious about what everyone was missing, about why such a seemingly straightforward symptom, hair loss, had become an unsolvable riddle. But Leora had learned something in her 6 years of nursing that most of the specialists had forgotten in their decades of medical school, buried under layers of differential diagnoses and evidence-based protocols and peer-reviewed studies. She'd learned that sometimes the answers aren't in the tests. Sometimes they're not in the blood work or the imaging or the genetic sequencing. Sometimes they're in the patient. In the way they move, the way they speak, the small unconscious gestures that reveal what words and lab values cannot. She'd grown up in a small town in rural Montana where the nearest hospital was 40 miles away, where people learned to pay attention to subtle signs because waiting for test results could mean the difference between catching something early and losing someone you loved. She'd watched her grandmother suffer through misdiagnosis because no one took the time to really look at her, to listen to what she was saying beyond just her symptoms. The doctors were efficient, professional, but always rushed, always moving on to the next patient, always trusting their tests more than their observations. Her grandmother died of a condition that should have been caught 6 months earlier. If only someone had noticed the way she favored her left side when she walked, the way she winced when she took deep breaths, the small tells that her body was screaming for help in a language the doctors didn't bother to learn. That's why Leora became a nurse. Not to follow protocols blindly, not to simply execute orders written by physicians who spent 5 minutes with patients before moving on. She became a nurse to see what others missed, to pay attention in a healthcare system that increasingly valued efficiency over observation, to be the kind of caregiver she wished her grandmother had found before it was too late. She developed her own approach over the years. When she entered a patient's room, she didn't immediately reach for the blood pressure cuff or pull up the electronic chart. She introduced herself. She sat down if she could, making herself level with the patient instead of standing over them in a position of authority. She asked open-ended questions and actually listened to the answers, watching not just for what patients said, but how they said it, what their bodies revealed that their words didn't. Other nurses sometimes teased her for taking too long with patients, for getting emotionally invested in cases that weren't hers to solve. But Leora couldn't help it. She'd seen too many people fall through the cracks of a system that prioritized throughput over thoroughness, that measured success in patient volumes rather than patient outcomes. And tonight, on what seemed like a completely routine shift, another night of vitals checks and medication rounds and charting in the quiet hours when most of the hospital slept, Leora's gift for paying attention would finally get the chance to prove itself. Leora knocked softly before entering, even though Thelma was awake. She could tell by the way the light from the hallway caught her eyes, that distant, sleepless look that patients get when hope has worn thin, when the nights stretch out endlessly and sleep feels like a luxury reserved for people whose bodies aren't betraying them. The hospital room was quiet at 2:47 in the morning, filled only with the soft, rhythmic beeping of monitors and the gentle hum of ventilation systems. Most of the diagnostic unit was asleep or trying to be, but Thelma lay there, eyes open, staring at the ceiling like it might hold answers that all those specialists couldn't find. "Hi, Thelma. I'm Leora. Just here for your vitals check. How are you feeling tonight?" Thelma gave that small, practiced smile. The one she'd perfected over months of answering the same question from dozens of different medical professionals. The smile that said, I'm cooperating. I'm being a good patient. Please don't ask me how I'm really doing because I don't have the energy to be honest anymore. Fine. Tired. I bet. Leora pulled up a chair instead of standing over the bed the way most nurses did, clipboard in hand, running through their checklist with efficient professionalism. She sat down, making herself eye level with Thelma, and let out a long breath. Mind if I sit? It's been a long shift, and these shoes are killing me. It was such a small thing, such a human thing. Not nurse to patient, but person to person. And Thelma's practiced smile softened into something more genuine. Of course, this is where Leora did something different. Something none of the 300 specialists had thought to do, or maybe they had thought of it, but decided it wasn't an efficient use of their valuable time. She didn't rush. She didn't immediately pull up the electronic chart and run through a checklist of vital signs and medication schedules. She didn't treat Thelma like a medical mystery to be solved with the right combination of tests and interventions. She just talked. She asked about Thelma's day, what she'd eaten, whether the food was as terrible as hospital food usually was, if she'd managed to get any real sleep, or just the fitful dozing that hospitals seem designed to prevent. She asked about her family, whether her father had visited today, how he was holding up under the stress. She asked what Thelma missed most about life before the hospital. Not life before the hair loss, but life before everything became appointments and tests and waiting for answers that never came. And while they talked, Leora watched. Not in a clinical way, not with the detached observation of a researcher studying a subject. She watched in the way a painter studies light as it changes across a landscape. In the way a musician listens for the off note in an orchestra, the subtle discord that reveals something important beneath the surface harmony. That's when she noticed it. The way Thelma tilted her head slightly to the left when the bedside lamp hit her eyes, like the light caused discomfort she'd learned to automatically adjust for. The way her hand instinctively moved to the back of her neck when she spoke about headaches. Not dramatic migraines that sent her to bed, but persistent, low-grade headaches that had become such a constant companion she barely registered them anymore. Small things, unconscious things. The kind of details that don't show up in patient interviews because people don't think to mention what's become normal. Leora noticed the way Thelma's fingers would absently massage that same spot at the base of her skull, the way she shifted her weight when she'd been sitting too long, the subtle wince that flashed across her face when she turned her head too quickly to the right. These weren't symptoms Thelma had reported. They weren't in any of the extensive medical records that documented every test, every consultation, every theory that had been explored and discarded. They were just the quiet adaptations a body makes when something is wrong, the unconscious accommodations we develop to live with chronic discomfort. Now, here's what you need to understand. Leora wasn't smarter than those 300 specialists. She didn't have access to tests they didn't have, didn't possess some advanced medical degree or specialized training they lacked. She didn't know some secret diagnostic technique that had been overlooked in all those conferences and consultations. What she had was time. Time to sit with Thelma not as a case to be solved, but as a person to be seen. And patience. Patience to let the conversation unfold naturally, to observe without agenda, to notice what revealed itself when you stopped looking so hard for answers. And perhaps most importantly, she had the willingness to let her patient guide her instead of the other way around. Instead of coming in with theories and using Thelma to confirm or deny them, she let Thelma's body tell its own story, reveal its own truth in the language of gesture and movement and unconscious adaptation. Thelma, would you mind if I did a quick physical exam? Nothing invasive, I promise. Just want to check something. Thelma nodded without hesitation. She'd been poked and prodded so many times over the past 13 months, examined by so many different hands, subjected to so many tests and procedures, that one more set of hands barely registered. What was another examination in the endless parade of doctors and specialists who'd all looked at her and found nothing? Leora stood and moved to the side of the bed, her movements deliberate and calm. She started where every nurse starts. The basics that become so routine, they're almost meditative. Pulse first, fingers gentle on Thelma's wrist, counting the steady rhythm. Normal. Then temperature, the thermometer beeping softly after a few seconds. Normal. Then blood pressure, the cuff inflating and deflating with that familiar whoosh of air. 118/76. Normal as always. Everything was always normal. That was the maddening part of this case, the detail that had driven 300 specialists to frustration and eventually defeat. By every measurable standard, Thelma Robinson was healthy. Her body functioned exactly as it should. The numbers never lied, and the numbers always said she was fine. But Leora wasn't interested in the numbers right now. She was interested in what the numbers couldn't measure. I'm going to check your scalp now, okay? Just going to feel around gently. She moved behind Thelma, her hands hovering for a moment before making contact. When she did touch Thelma's head, her fingers were warm, careful, respectful of the tenderness that comes with chronic, unexplained illness. She worked methodically, section by section, her fingertips moving through what remained of Thelma's hair with the thoroughness of someone searching for something specific, but not yet sure what. She wasn't looking for bald spots. Those were obvious, visible to anyone with eyes. She wasn't checking for inflammation or lesions, or any of the things the dermatologist had already examined a dozen times over. She was looking for something else, something her conversation with Thelma had suggested might be there, hiding beneath the surface where standard examinations wouldn't think to probe. Her fingers moved from the crown of Thelma's head down toward the nape of her neck, following the natural curve of the skull, feeling for irregularities in the bone structure, in the tissue, in anything that might explain why Thelma unconsciously tilted her head away from light, why her hand always drifted to that same spot when she talked about headaches. And then her fingers paused. Right at the base of Thelma's hairline, where skull meets neck, where the occipital bone curves down to meet the first cervical vertebra. There was something there. Something so faint, so subtle, that you'd miss it completely if you weren't actively searching for it, if your fingers weren't trained to detect the smallest deviations from normal anatomy. A line of tissue, barely raised, almost invisible beneath the remaining hair. Old scar tissue, the kind that forms when skin heals over a wound and leaves behind a mark so faded that time has nearly erased it. Thelma, have you ever had any head injuries? Maybe when you were younger? Even something minor. Thelma thought for a moment, her brow furrowing with the effort of memory. I don't think so. What? There's a small scar here. Very old. Almost invisible. Did anyone else notice this? Leora kept her voice calm, professional, but her heart was beating faster now because she knew that she'd found something important, something that every other examination had somehow overlooked. Thelma's hand went to her neck, fingers searching for what Leora had found. A scar? I don't remember. Wait. Her voice changed, memories surfacing from years ago, from a time before hair loss and hospitals and endless medical appointments. When I was 16, I fell off a horse. Hit my head on a fence post. Went to the ER. They said I was fine, just gave me ice and sent me home. 8 years ago. Leora's mind was already racing, connecting dots that suddenly seemed blindingly obvious. 8 years ago, a head injury. Minor enough that the emergency room doctors deemed it not serious, sent her home with standard post-concussion instructions and nothing more. No follow-up imaging. No long-term monitoring. Just a teenager who hit her head, seemed okay, and was cleared to go on with her life. But what if it wasn't okay? What if that impact, that moment of trauma, had caused damage that wasn't immediately apparent? What if there was a fracture, small and stable, that had gone undetected because no one thought to look for it? What if that fracture, over the course of 8 years, had been gradually shifting, pressing against nerves, causing problems that wouldn't show up on standard tests because no one was imaging the right area? The hair loss had started 13 months ago, but that didn't mean the underlying cause started 13 months ago. Nerve compression can be progressive, building slowly over time until symptoms finally manifest. A fracture from 8 years ago could absolutely be causing problems now, especially if it was in exactly the right, or wrong, location to affect the nerve pathways responsible for hair follicle function. What Leora suspected in that moment would turn this entire case on its head. Because if she was right, it meant that 300 specialists hadn't just missed something small, some obscure detail that required exceptional skill to detect. They'd missed something that had been causing Thelma's suffering for over a year. Something fundamental, something that could have been found with one simple test that no one had bothered to order because no one thought to connect a childhood injury to a present-day symptom. They'd missed it because they never asked the right question. Because Thelma's intake forms mentioned the fall, but it was listed under past medical history and dismissed as irrelevant ancient history. Because when you're looking for rare autoimmune diseases and genetic abnormalities, you don't think to order a high-resolution scan of old injury sites. Now, you'd think that finding a potential breakthrough would be cause for celebration. You'd think the doctors would listen with interest, investigate immediately, thank Leora for her diligence and careful observation. You'd think that after 13 months of failure, after 300 specialists coming up empty, someone would be grateful for a new lead, no matter where it came from. You'd be wrong. The first Dr. Leora approached barely looked up from his tablet. Dr. Blumrio, a neurologist who'd been consulting on Thelma's case for the past 3 weeks, stood at the nurse's station reviewing patient charts with the efficient detachment of someone who had 17 other cases demanding his attention. Dr. Rio, I need to talk to you about Thelma Robinson. Nurse Vance, we've done 17 different imaging studies on this patient. If there was a structural issue, we would have found it. But this scar is right over the occipital nerve cluster. If there's any kind of fracture or compression, we've reviewed her imaging. There's nothing there. He didn't even look at her, just kept scrolling through his tablet, already moving on to the next patient, the next problem, dismissing her observation before she'd even finished explaining it. But the imaging wasn't high resolution at the injury site. If we could just... He walked away mid-sentence, called to another patient's room by a resident who needed consultation. Leora stood there, words dying in her throat, watching him disappear down the hallway without a backward glance. She tried 3 more doctors on shift. Dr. Patricia Holmes, an endocrinologist. Dr. James Winters, another neurologist. Dr. Rebecca Santos, the lead physician on the diagnostic team. Same response every time. Variations on the same theme. We've already looked. We've already tested. If it was there, we would have found it. Dr. Santos was the worst. She listened to Leora's explanation with a patient smile, the kind of expression you'd give a child who thinks they've made an important discovery about something adults already understand. When Leora finished, Dr. Santos placed a hand on her shoulder, gentle, patronizing, and said, I appreciate your concern for the patient. I really do. But perhaps you should stick to nursing duties and let the specialists handle diagnostics. We've got this covered. Stick to nursing duties. As if observation wasn't a nursing duty. As if patient care began and ended with administering medications and checking vital signs. As if 6 years of watching, listening, noticing what others missed counted for nothing compared to medical degrees and specialized training. Leora found herself in the break room at 4 in the morning, exhausted, staring at a cup of coffee that had gone cold an hour ago. The fluorescent lights hummed overhead, casting everything in that harsh, institutional glow that makes every surface look tired and worn. She should have been finishing her shift, documenting her rounds, going home to sleep. Instead, she sat there replaying every conversation, every dismissal, wondering if maybe they were right. Maybe she was overstepping. Maybe that scar didn't mean anything. Maybe she was seeing connections that weren't there because she wanted so badly to be the one who helped, who made a difference. This is the moment where most people would have given up, would have said, I tried, documented their observation in the patient notes, and moved on. Let it be someone else's problem, someone else's responsibility. After all, who was she to question 300 experts? Who was she to think she knew better than doctors with decades more experience, with walls full of degrees and publications and awards? Who was she to believe that her gut instinct, her careful observation during one night shift, could be more valuable than all their sophisticated testing and analysis? But Leora couldn't stop thinking about Thelma's face. The way hope had flickered in her eyes when Leora asked about the old injury. Like maybe, finally, someone was looking in a direction no one else had considered. She couldn't stop thinking about Admiral Robinson, standing by that window every single day, watching his daughter fade. This powerful man reduced to helplessness by a system that had all the tools but couldn't find the answer. And she couldn't stop thinking about all the times in her own life when someone with authority had dismissed something important because it came from someone they considered less qualified. Her grandmother told her pain was probably just anxiety, probably just age, probably nothing serious, until it was too late. Her nursing school professors, who'd valued protocol over critical thinking, who'd taught them to follow orders rather than question them. Every patient she'd ever seen fall through the cracks because the system was too rigid, too hierarchical, too convinced of its own infallibility to listen. So she did something risky. Something that could get her reprimanded, written up, maybe even fired depending on how badly it went. She picked up the phone at the nurse's station, scrolled through the hospital directory, and found the name she was looking for. Dr. Sarah Rio. Not related to Dr. Blum Rio. Different person entirely. Senior attending physician, 23 years at St. Catherine's, known for being tough but fair, for actually listening to nursing staff, for caring more about patient outcomes than institutional politics. Leora had never spoken to her directly. Dr. Rio operated several levels above a night shift nurse in the hospital hierarchy. But she had a reputation, whispered among the nursing staff, of being someone who'd go to bat for patients when others wouldn't, who valued good care over professional ego. Leora took a breath and dialed her extension, knowing this could go very wrong, knowing she was potentially ending her career before it really began. And what happened next would either vindicate her instincts and change everything for Thelma Robinson, or mark Leora Vance as an overstepping nurse who didn't know her place, ending any hope she had of being taken seriously in this hospital ever again. If you've ever been told you're wrong by someone who refused to listen, if you've ever had to fight for what you knew was right even when everyone with more power and more credentials dismissed you, hit that like button right now. Because Leora Vance is about to show us all what happens when you refuse to back down, when you put patient care above professional safety, when you risk everything because staying silent feels like betrayal. And if you can't stand medical arrogance, if you're sick of watching qualified people get dismissed because they don't have the right letters after their name, comment, "Nurses know best," to stand with her. Dr. Sarah Rio had been at St. Catherine's for 23 years. She'd seen it all. Medical miracles that defied every statistic, tragic losses that still haunted her in quiet moments, breakthrough diagnoses that came at the 11th hour, cases that slipped through everyone's fingers despite heroic efforts. And more than her fair share of ego battles between specialists, turf wars over patient management, brilliant doctors who let their pride get in the way of good medicine. When her pager went off at 6:15 in the morning with a message from a night shift nurse requesting an urgent consult, her first instinct was to ignore it. She'd been up late the night before reviewing cases, had maybe 4 hours of sleep, and wasn't officially on duty for another 45 minutes. Whatever it was could wait, could be handed off to the incoming day shift, could be addressed through proper channels rather than a direct page to a senior attending. She almost deleted the message, almost rolled over and tried to grab another 20 minutes of rest before her alarm went off. But something in the message caught her attention. It wasn't the typical urgent request, patient crashing, immediate intervention needed, all hands on deck. It was specific, detailed, the kind of message that suggested whoever sent it had actually thought through what they were asking for and why. Potential occipital fracture missed on imaging. Patient's history of head trauma 8 years ago never correlated with current symptoms. Request immediate high-resolution scan of C1, C2 vertebrae and skull base. Patient, Thelma Robinson, room 407. Thelma Robinson, the Admiral's daughter. The impossible case that had become a legend in the hospital. The mystery that had stumped every specialist who touched it. Dr. Rio had reviewed the case file weeks ago when the diagnostic team requested input from senior staff. She'd read through the extensive documentation, the hundreds of test results, the countless consultant notes. She'd had nothing to add that hadn't already been considered. Just another expert adding her name to the list of people who couldn't solve it. But occipital fracture? Missed on imaging? That was specific. That suggested someone had found something, noticed something, connected dots that others hadn't. And the mention of head trauma from 8 years ago, that was interesting. That was the kind of detail that gets buried in medical histories, listed as past and irrelevant, never connected to present symptoms, because who thinks a childhood injury could cause problems nearly a decade later? Dr. Rio sat up, sleep forgotten. She read the message again, then checked who'd sent it. Leora Vance, night shift nurse, 6 years experience. Not someone she knew personally, but the specificity of the request suggested this wasn't a panicked overreaction or a nurse overstepping boundaries. This was someone who'd observed something, thought it through, and had enough confidence in their assessment to page a senior attending at dawn. She responded, "My office. 15 minutes." Leora stood outside Dr. Rio's office at 6:32 in the morning, heart pounding so hard she could feel it in her throat, prepared for another dismissal, another condescending lecture about staying in her lane. Her shift had ended 30 minutes ago. She should have been in her car driving home, trying to decompress from the frustration of being ignored by 4 different doctors. Instead, she stood here, exhausted, running on adrenaline and coffee and the stubborn refusal to let this go. The door opened. Dr. Sarah Rio looked exactly like Leora expected. Early 50s, gray streaking through dark hair pulled back in a practical ponytail, sharp eyes that missed nothing, the kind of presence that commanded respect without needing to demand it. She wore scrubs and a white coat, clearly already preparing for her day despite the early hour. But when those sharp eyes met Leora's, she didn't see annoyance or dismissal. She saw curiosity, real, genuine interest. Nurse Vance, come in. The office was small but organized, walls lined with medical texts and journals, a desk covered in patient files and research papers, diplomas and certifications that spoke to decades of dedication. Dr. Rio gestured to a chair across from her desk and sat down, pulling out a legal pad and pen, not a tablet, not a computer, but actual paper, like she wanted to give this her full attention without digital distractions. Walk me through your thinking, and don't skip any details. Not explain yourself, not justify why you're wasting my time. Just a straightforward request to present her case, delivered in a tone that suggested Dr. Rio was actually prepared to listen. Leora took a breath and began. For the next 15 minutes, she laid out everything. She described her conversation with Thelma, the way she'd watched and noticed the small, unconscious movements. The slight head tilt when light hit her eyes, the hand that constantly drifted to the back of her neck, the subtle wince when turning her head too quickly. She explained how these observations had prompted her physical examination, how she'd found the nearly invisible scar tissue at the base of Thelma's hairline, how Thelma had remembered the childhood injury only when directly asked. She talked about the timeline. Injury 8 years ago, hair loss beginning 13 months ago, and how that fit perfectly with the progression of nerve compression. How damage from an old fracture could be stable for years before gradual shifting caused symptoms to manifest. How the pattern of Thelma's hair loss corresponded exactly to the nerve pathways that would be affected by compression at that specific location. She explained why the previous imaging had missed it. Because they'd been looking for active disease, for inflammation, for soft tissue abnormalities, not for old skeletal trauma. Because standard resolution scans of the wrong area wouldn't show a hairline fracture in the occipital bone. Because no one had thought to correlate an 8-year-old injury with a 13-month-old symptom. Dr. Rio listened without interrupting, taking notes, occasionally nodding. When Leora finished, the office fell quiet. Dr. Rio reviewed her notes, tapping her pen against the paper, thinking. The silence stretched. Leora felt her confidence wavering. Maybe this was the moment Dr. Rio would explain, kindly but firmly, why this theory didn't hold up, why the other doctors had been right to dismiss it. Why? Dr. Rio looked up. The previous CT scans were standard resolution, focused on ruling out masses and inflammation. You're suggesting we need a high-resolution scan specifically of the occipital bone and upper cervical spine. Yes, if there's a fracture, if there's any compression of the nerve cluster. Dr. Rio picked up her phone. Give me radiology. I want a high-resolution CT of the cervical spine and skull base for Thelma Robinson, room 407. Today, priority 1. Yes, I know we've already imaged her. This is different. We're looking for skeletal abnormalities, old trauma, potential nerve compression at the occipital region. I need the highest resolution you can give me. She hung up and looked at Leora. They'll have her in imaging within 2 hours. Good work, Nurse Vance. Within 2 hours, Thelma Robinson would be in imaging again. But this time, they'd be looking in the right place, asking the right questions, searching for what had been there all along. This time, they'd finally see what 300 specialists had missed, what had been hidden in plain sight for over a year, what one-night shift nurse had found by doing the simplest, most revolutionary thing possible, actually looking at her patient. Admiral Robinson stood in the observation room, arms crossed tightly across his chest, trying not to hope. He'd been disappointed too many times over the past 13 months. Watched too many confident doctors walk into Thelma's room with theories and certainty, only to emerge weeks later confused and apologetic. Heard too many promises that this test will tell us what we need to know, followed by results that told them nothing at all. But something about the way Dr. Rio had explained this felt different. She hadn't promised answers, hadn't oversold the possibility. She'd simply said, "We're going to look somewhere we haven't looked before, and we'll see what we find." Honest, direct, no false hope, but no dismissal either. Thelma lay on the scanning table, perfectly still as the machine hummed and whirred around her. She'd done this so many times now that the claustrophobia had faded, replaced by a kind of numb acceptance. Another scan, another set of images that would probably show nothing, just like all the others. The technicians moved with practiced efficiency, adjusting angles, calibrating settings, speaking in the technical shorthand of people who'd done this procedure thousands of times. Dr. Rio stood beside the radiologist, Dr. Blum-Okonkwo, both of them watching the monitor as images began forming in real time. The CT scanner worked in slices, building a three-dimensional picture of Thelma's skull and upper spine layer by layer, each cross-section revealing structures invisible to the naked eye. The images came through slice by slice, section by section. The radiologist narrated quietly, more for his own benefit than anyone else's, identifying structures as they appeared. Occipital bone, atlas vertebra, axis vertebra, soft tissue, musculature. At first, nothing unusual, just normal human anatomy doing what human anatomy does. Admiral Robinson felt his shoulders tensing, that familiar disappointment beginning to settle in again. Of course it was nothing. Of course this was just another dead end, another theory that sounded promising but led nowhere. Then Dr. Rio leaned forward, her eyes narrowing. "Wait, go back 2 slices." The radiologist scrolled back, and there it was. There, right there. So small that previous scans, done at standard resolution and focused on different areas, had missed it completely. A hairline fracture in the occipital bone, barely visible even now. A thin dark line running through the bone structure right where an old trauma site had never fully healed. The fracture itself was ancient, clearly years old, the bone having attempted to repair itself but never quite succeeding, leaving behind this permanent weakness, this subtle deviation from normal architecture. And pressed against it, compressed by scar tissue and subtle bone misalignment that had developed over years, was a cluster of nerves. The occipital nerve bundle, responsible for sensory function across the back of the scalp, but also, critically, connected to the autonomic pathways that regulated hair follicle function in that exact region. Dr. Okonkwo zoomed in, enhancing the image, adding color coding to highlight the nerve compression. The visualization was stark and undeniable. You could see exactly where the bone fragment pressed against the nerve cluster, where scar tissue had formed around the injury site, where the normal spacing between bone and nerve had been eliminated by gradual, progressive encroachment. Regulating hair follicle function in the exact pattern where Thelma had been losing hair, Dr. Rio said quietly, almost to herself. She pulled up photos of Thelma's scalp from the medical records, comparing the pattern of hair loss to the nerve compression visible on the scan. They matched perfectly. The areas of most severe hair loss corresponded exactly to the nerve pathways most severely compressed. Dr. Rio sat back in her chair, and for a moment, she just stared at the screen. My God! It's been there the whole time. The radiologist zoomed in further, examining the fracture from multiple angles, measuring the degree of nerve compression, documenting everything with the meticulous detail that would be needed for surgical planning. This fracture is at least 8 years old. You can see the attempted healing, the bone remodeling, probably from initial impact. Looks consistent with blunt force trauma to the back of the head, but it's been gradually shifting. See this slight displacement here? That's not from the original injury. That's progressive, probably happening over years as normal head movements and muscle tension slowly move the bone fragment. The nerve compression would have been minimal at first, barely noticeable. Maybe occasional headaches, some light sensitivity, things you'd dismiss as normal. But over time, it would progressively worsen, Dr. Rio finished, exactly matching her symptom timeline. 13 months ago, the compression reached a threshold where it began significantly affecting nerve function. Hair follicles are incredibly sensitive to nerve disruption. Once the signal gets interrupted, they shut down, stop producing hair, eventually die off completely if the compression isn't relieved. Admiral Robinson's hands were shaking. He gripped the back of a chair to steady himself. And this time the tremor wasn't from fear or helplessness or the crushing weight of watching his daughter suffer without answers. This time it was from relief, so overwhelming, so complete, so utterly unexpected after 13 months of disappointment that it threatened to buckle his knees. His voice came out rough, barely more than a whisper. "Can you fix it, Dr.?" Rio turned to face him, and for the first time since this nightmare began, he saw absolute confidence in a doctor's eyes. Not the false confidence of someone pretending to have answers they didn't possess, but the real certainty of someone who knew exactly what the problem was and exactly how to solve it. "Yes, Admiral, we can fix it." But here's the part that made this discovery so devastating, the detail that would haunt everyone involved long after Thelma recovered. This type of fracture shows up on standard CT scans. It should have been caught. There was no exotic technology required, no experimental imaging technique, no cutting-edge diagnostic tool that only a handful of hospitals possessed. This was basic radiology, the kind of scan that gets ordered thousands of times every day in hospitals across the country. The reason it wasn't caught? The previous imaging had been focused on soft tissue abnormalities, hormone-producing centers, autoimmune markers, inflammation patterns, everything except basic skeletal structure. Because when faced with a mysterious symptom, the specialists had assumed it must be something complex, something rare, something that required their specialized knowledge to identify. They'd been looking for zebras, exotic diagnoses that would justify all their training and expertise. And in doing so, they'd completely missed the horse standing right in front of them. A simple fracture, an old injury, something that any first-year radiology resident could have spotted if they'd been looking at the right place with the right resolution. 300 specialists, 13 months, 143 tests, and the answer had been there all along, waiting for someone to look in the most obvious place. What happened next wasn't about blame. Dr. Rio made that clear from the very beginning, before anyone even entered the conference room, before the uncomfortable conversations began. This wasn't a witch hunt. This wasn't about pointing fingers or destroying careers or making examples of people who genuinely tried their best. This was about understanding how 300 highly trained specialists, equipped with the best technology and unlimited resources, could miss something that a night shift nurse found in one careful examination. The diagnostic team gathered in conference room B at 2 o'clock that afternoon. Neurologists, endocrinologists, dermatologists, rheumatologists, all the specialists who'd examined Thelma over 13 months. Some came willingly, curious about what had finally cracked the case. Others came reluctantly, already defensive, already preparing justifications for why they hadn't found what apparently had been there all along. The room held maybe 20 physicians, representing hundreds of years of combined medical experience, walls lined with degrees from the most prestigious institutions in the world. Dr. Rio stood at the front of the room, her laptop connected to the large screen behind her. She didn't waste time with pleasantries or preambles. She simply pulled up the high-resolution CT scan and let them see what they'd missed. The room fell silent. Doctors who'd been quietly conversing stopped mid-sentence. You could see the realization dawning on faces, the discomfort settling in as they understood what they were looking at. A hairline fracture, nerve compression, something fundamentally, almost embarrassingly simple. Something that had been causing Thelma's suffering for over a year while they'd searched for exotic explanations. Someone cleared their throat. Someone else shifted in their chair. The silence was heavy with unspoken questions, with professional pride taking a beating, with the uncomfortable recognition that they'd failed not because they lacked skill, but because they'd approached the problem wrong. "This isn't about anyone's competence," Dr. Rio said, her voice steady but firm. "Everyone in this room is excellent at what you do. You're brilliant diagnosticians. You followed protocols, ordered appropriate tests, consulted with colleagues. You did everything right according to how we've been trained to approach mysterious cases. And that's exactly the problem." She let that sink in for a moment, then continued. "We were so focused on finding a complex answer that we never considered a simple one. We ordered hundreds of specialized tests, genetic sequencing, rare disease panels, experimental antibody markers, but we never ordered a basic high-resolution scan of the injury site from her medical history. We looked for zebras and missed the horse." One of the neurologists, Dr. James Winters, the same one who dismissed Leora's concerns that morning, spoke up. His voice was heavy with something between frustration and shame. Her intake form mentioned the childhood fall. I saw it. It's right there in her medical history. But it was 8 years ago, and she said it was minor, treated, and released from the ER. I didn't think. Exactly. Dr. Rio interrupted, not unkindly, but firmly. You didn't think it mattered. None of us did. And that's the systemic issue we need to address. Because we've been trained to look for exotic diseases, rare syndromes, complex conditions that require our specialized knowledge. Medical education teaches us to think about the unusual, the complicated, the diagnostically challenging. We've forgotten that sometimes the simplest explanation is the right one. Dr. Patricia Holmes, one of the endocrinologists, leaned forward. But we did imaging. Multiple scans. If there was a fracture, standard resolution scans focused on ruling out masses, inflammation, hormonal abnormalities, Dr. Rio said. None of you ordered skeletal imaging of the occipital region because none of you were thinking about old trauma as a current cause. The injury was listed in her history, but it was filed away as irrelevant past information. We saw it, we acknowledged it, and we dismissed it. Another doctor, younger, maybe a resident or fellow, raised a tentative hand. So what should we have done differently? Dr. Rio pulled up Thelma's intake form, the one that every specialist had reviewed, the one that clearly listed under past medical history. Age 16, fall from horse, head trauma, ER visit, release same day. Right there in black and white, seen by dozens of eyes and dismissed by every single one. We should have connected past to present, Dr. Rio said. We should have asked ourselves, could this old injury be relevant? We should have thought mechanistically about what could cause progressive hair loss in this specific pattern. We should have listened when a nurse who spent time actually observing the patient noticed things we missed in our 5-minute consultations. The room shifted uncomfortably at that, because everyone knew who'd found the fracture. Everyone knew it wasn't one of the specialists with decades of experience. It was Leora Vance, a night shift nurse with 6 years of experience, someone most of the doctors in this room had dismissed when she tried to bring this to their attention. This case should humble us, Dr. Rio continued. Not humiliate us, but humble us. It should remind us that medical training, for all its rigor and sophistication, can sometimes train us to overlook the obvious. We become so specialized that we forget the basics. We become so focused on our particular domain of expertise that we don't see the whole patient. And this is where this story becomes about more than just Thelma Robinson and her mysterious hair loss. Because if this could happen here, at St. Catherine's Medical Center, ranked in the top 10 hospitals in America, staffed by some of the brightest minds in medicine, equipped with cutting-edge technology and unlimited resources, if 300 specialists could miss a simple fracture here, then how many other patients are suffering from simple problems that get overlooked because they don't fit the expected pattern? How many people are being told their symptoms are psychological when they're actually physical? How many are undergoing expensive, invasive testing for rare diseases when the answer is something basic that no one thought to check? How many are suffering because the healthcare system has become so specialized, so compartmentalized, so focused on complexity that it's forgotten how to see simple truths? The doctors in that conference room weren't bad at their jobs. They were victims of a system that had trained them to think a certain way, to value certain types of knowledge over others, to trust tests more than observation, to respect credentials more than careful attention. And one night shift nurse, trained differently, approaching the problem from a different angle, had seen what they all missed. The surgery itself was relatively straightforward. At least, that's how Dr. Rio described it when explaining the procedure to Admiral Robinson the night before. Decompress the nerve cluster by carefully removing the pressure from the bone fragment. Smooth the fractured section of the occipital bone to eliminate any sharp edges that might cause future problems. Remove the scar tissue that had been pressing against those vital nerve pathways for over a year, slowly strangling the signals that kept Thelma's hair follicles alive and functioning. 3 hours, start to finish. A routine neurosurgical procedure, the kind that the team at St. Catherine's performed regularly. Dr. Rio would lead, assisted by Dr. Okonkwo and a surgical resident. Anesthesia would keep Thelma unconscious and pain-free. The risks were minimal. This wasn't brain surgery, wasn't touching anything critical to life or cognitive function. Just careful, precise work to undo damage that time and circumstance had created. But for Admiral Robinson, waiting in the surgical lounge on the 3rd floor, Those 3 hours felt like 3 years. He sat in one of those uncomfortable vinyl chairs that every hospital waiting room seems to have, designed more for easy cleaning than human comfort. His hands gripped the armrests, knuckles white, watching the clock on the wall tick forward with agonizing slowness. He'd faced combat. He'd made decisions that sent people into danger. He'd stood on the bridge of aircraft carriers during storms that should have sunk them. But nothing in his military career had prepared him for this particular kind of helplessness. Sitting in a waiting room while someone operated on his daughter's skull, unable to do anything but wait and hope and pray that this time, finally, the nightmare would end. Leora sat with him for part of it. She'd finished her shift hours ago, should have been home sleeping after a long night. But she'd stayed, quietly taking a seat 2 chairs down from the Admiral, not saying much, not offering false reassurances or empty platitudes. Just present, just there. Because sometimes the most important thing you can do for someone is simply not leave them alone. They didn't talk much. What was there to say? The Admiral wasn't much for small talk under the best circumstances, and these weren't the best circumstances. But at one point, about 90 minutes into the wait, he turned to her. "Thank you," he said quietly, "for seeing her, for really seeing her." Leora nodded. "She's easy to see, sir, once you take the time to look." 2 hours and 47 minutes after Thelma had been wheeled into surgery, the waiting room doors opened. Dr. Rio emerged, still in her surgical scrubs and cap, and she was smiling. Not the polite, professional smile that doctors give when they're about to deliver carefully worded news. A real smile, the kind that reaches the eyes, the kind that carries genuine relief and satisfaction. Admiral Robinson was on his feet before she'd taken 3 steps into the room. "The surgery went perfectly," Dr. Rio said. "We relieved all the pressure on the nerve cluster. The bone fragment was exactly where the imaging showed it, and we were able to smooth it down without any complications. The scar tissue came away cleanly. Everything looks good. And her hair." The Admiral's voice was rough with emotion he was struggling to control. "Now we wait and see how her body responds," Dr. Rio said honestly. "We've removed the cause of the problem. We've given those nerve pathways the chance to heal and start functioning normally again. But hair follicle regeneration doesn't happen overnight. It takes time." Thelma woke up in post-op recovery about an hour later, groggy from anesthesia, but stable. Her head was bandaged, and she had the distant, confused look that people get when emerging from deep sedation. The Admiral sat beside her bed, holding her hand, saying nothing because there was nothing that needed to be said. She was alive. The surgery was successful. For the first time in 13 months, they had a real path forward. Hair follicle regeneration doesn't happen overnight. Dr. Rio had been clear about that, managing expectations even in the moment of triumph. It would take weeks to see results, maybe months for full regrowth. The nerves needed time to heal, to remember their function, to start sending the signals that would wake dormant follicles and encourage new growth. But for the first time in over a year, there was a clear path forward, an actual explanation for what had been happening. Real hope grounded in understanding rather than desperate faith. They knew what had been wrong. They'd fixed it. Now it was just a matter of time. The weeks that followed were an exercise in patience. Thelma went home after 3 days in the hospital, recovering from the surgery itself quickly. The incision healed cleanly. The headaches that she'd grown so accustomed to that she'd stopped mentioning them gradually faded. The light sensitivity diminished. Small improvements that confirmed the nerve compression had been the root cause of more than just the hair loss. But the hair itself? That took longer. Week 1, nothing visible. Week 2, still nothing. Admiral Robinson caught himself checking anxiously every time he visited, looking for signs of new growth, trying not to show his worry that maybe the damage had been permanent. Maybe they'd waited too long, maybe. Week 3, Thelma noticed it first. Tiny, almost invisible new strands along her hairline. So fine they were barely there, like baby hair, like the first delicate growth of spring after a long winter. She called her father, voice shaking with emotion. "It's growing back. Dad, it's actually growing back." Week 4, the growth was undeniable. Thin, yes. Sparse, yes. But growing. Week 5, thicker. Week 6, filling in the patches that had been bare for so long. And then, 6 weeks after surgery, on a sunny Tuesday morning in late spring, something extraordinary happened. Thelma Robinson walked into St. Catherine's Medical Center on her own 2 feet, wearing a yellow sundress and a smile that hadn't dimmed in 6 months. Her hair, thick, healthy, growing back in waves that caught the afternoon light, framed her face the way it used to, the way it was supposed to. The same sunlight that streamed through those tall hospital windows, the light that had once illuminated her suffering as her father stood helpless watching, now caught the shine of restored health, of life reclaimed. She wasn't there for treatment this time. No appointments, no tests, no doctors waiting to examine her and explain what they still didn't understand. She was there to say thank you. Leora was at the nurse's station when she saw Thelma coming down the hall. For a moment, she didn't recognize her. This vibrant young woman, moving with confidence and joy, looked nothing like the exhausted, hopeless patient from that night shift 6 months ago. But then their eyes met, and recognition sparked, and Thelma's smile grew even wider. "Leora, I wanted you to see." Thelma gestured to her hair, laughing through tears that were already forming. "Look at it. It's all back. Oh my God, Thelma, you look amazing." They embraced right there in the hallway. Two women who'd been strangers 6 months ago, now connected by a moment of careful observation that had changed everything. Thelma was crying, and Leora was crying, and neither of them cared who saw. "Because of you," Thelma whispered. "Because you took the time to actually look at me, to listen, to see what everyone else missed." Admiral Robinson was there too, standing a respectful distance back, giving them their moment. And when they finally separated, when Thelma wiped her eyes and turned to include her father in the reunion, he stepped forward and did something he'd never done before in his decorated military career. He saluted a civilian. Not the casual acknowledgement of respect, but a full formal salute. Back straight, hand crisp, eyes meeting Leora's with an intensity that spoke volumes. "Nurse Vance, you gave me my daughter back. There are no words, no medals, no honors that can match that gift." "Thank you." Leora, never comfortable with praise, simply smiled. "I was just doing my job, sir. Really looking at my patient. That's all." But it wasn't just her job. It was her calling. And it's a reminder that sometimes the most important medical breakthroughs don't come from the most qualified people in the room. They come from the people who care enough to look beyond the chart and see the human being in front of them. St. Catherine's Medical Center made changes after Thelma's case. Real ones. Not the superficial policy updates that get announced with fanfare and quietly forgotten within months, but fundamental shifts in how they approached patient care and diagnostic medicine. They updated their diagnostic protocols to include comprehensive patient history reviews for all specialists, requiring doctors to specifically examine past injuries and traumas, no matter how old or seemingly minor, before ordering expensive specialized tests. They created collaborative diagnostic teams where nurses' observations carried equal weight to doctors' assessments, where a night shift nurse's careful attention was valued as much as a specialist's test results. They implemented mandatory training on cognitive biases in medicine, exploring the tendency to overlook simple explanations when searching for complex ones, the danger of dismissing past medical history as irrelevant, the risk of letting professional ego override patient care. Dr. Rio presented Thelma's case at a national medical conference that fall. She stood before hundreds of physicians and told them the uncomfortable truth about how 300 specialists had missed what one nurse found. The presentation went viral in medical circles, sparked debates in journals, became required viewing in grand rounds across the country. It became a teaching example in nursing schools and medical schools, not as a story of failure and shame, but as a story of what's possible when we remember that medicine is both science and art, and that sometimes the art of really seeing your patient is just as important as the science of treating them. Leora Vance was promoted to Diagnostic Liaison Nurse, a newly created position designed to bridge the gap between clinical observation and medical diagnosis. She trains new nurses now, teaching them the same lessons she learned years ago watching her grandmother suffer through misdiagnosis. Credentials matter, but careful attention matters more. She teaches them to sit with patients, to watch how they move, to listen not just to what they say, but to what their bodies reveal. She teaches them that being just a nurse is actually being the person who spends the most time with patients, who sees things doctors miss in their 5-minute consultations, who has the power to change outcomes if they refuse to be silent. And Thelma? She enrolled in nursing school, decided that if she was going to work in medicine, and she was, because watching healthcare from the patient side had ignited something in her. She wanted to be the kind of healthcare provider who saved her life. Someone who sees patients, not just symptoms. Someone who listens, not just tests. Someone who remembers that behind every mysterious case is a human being who deserves to be seen. Because in the end, that's what this story is really about. Not the 300 experts who missed the diagnosis, though their failure matters. Not even the one nurse who found it, though her courage and observation changed everything. It's about the simple, radical act of paying attention, of treating people like they matter, of refusing to stop looking just because everyone else has given up.